Hey everyone, Drew here with MDITV.com. Here's your latest medical news headlines. Sit back and enjoy. Alright, let's get these headlines started. First off, we got a heavy hitter from medicalnewstoday.com. They're saying that obesity harms women's memory and brain function. The more an older woman weighs, the worse her memory, according to new research from Northwestern Medicine. The effect is more pronounced in women who carry excess weight around their hips, known as pear shapes, than women who carry it around their waists, called apple shapes. The study of 8,745 congenitally normal postmenopausal women ages 65 to 79 from the Women's Health Initiative hormone trials is the first in the United States to link obesity to poor memory and brain function in women to identify the body shape connection. The article goes on to say for every 1 point increase in a woman's BMI, her memory score dropped by 1 point. The women were scored on a 100-point memory test called the Modified Mini Mental Status Examination. The study controlled for such variables as diabetes, heart disease, and stroke. Alright, heading over to news-medical.net, they are reporting that 8.8% of drug-related hospital emergency department visits by adolescents is a suicide attempt. A new series of studies analyzing drug-related hospital emergency department visits throughout the country during 2008 reveals a substantial percentage of these visits involve suicide attempts. More than 1 in every 12 drug-related hospital emergency department visit by an adolescent is a suicide attempt, which is double the rate found among cases involving those aged 25 and older. The vast majority of these suicide attempts by adolescents were made by females. Females constituted a majority of cases among young adults and those over age 25 as well, but at significantly lower levels. And the article concludes stating that there's an effort to provide support for teens who may be contemplating suicide. The Substance Abuse and Mental Health Service Administration and the Ad Council recently launched the Teen Suicide Prevention Camp. The We Can Help Us effort includes television, radio, print, and interactive PSAs, as well as in-school and mall posters directed at 13 to 17-year-olds. Alright, jumping over to ReutersHealth.com, they're reporting that if you're trying to lose weight and to keep it off, new research suggests you take up a diet and exercise plan that will help you lose a big chunk of the weight right off the bat. Some doctors and dietitians think that losing lots of weight fairly quickly makes it more likely that dieters will gain most of it back, and so they often encourage overweight and obese patients to lose weight in small increments. But scientists have found that no matter how much weight people initially lose, they seem to gain back a similar percentage of that weight over the next year. If long-term weight is what you care about, it should be recommended and favored that people lose a high amount of weight, said one of the doctors involved in the study. The authors of this new research analyzed data from 12 different weight loss studies covering almost 1,000 overweight and obese participants. In all the studies, participants went through an intensive weight loss program that gave them exercise and nutrition guidance. The programs lasted between 10 weeks and 1.5 years depending on the study. The researchers also add that doctors should encourage weight loss of 10% or more in their overweight and obese patients if the goal is to have them at their slimmest down the road. And heading over to CNNHealth.com, if you are trying to lose that weight, you might not want to make a salad. It's being reported that romaine lettuce has been recalled in the U.S. and romaine lettuce salads from the Fresh Express brand are being recalled by both U.S. and Canadian food safety agencies because the products may be contaminated with E. coli. No illnesses have been reported in association with the recall. The voluntary recall involves Fresh Express salad products with expired use dates by July 8th through the 12th and an S in the product code because they could be contaminated with E. coli 0157:H7. Then CNN Health sums it up. Eating food contaminated by the E. coli 0157:H7 bacteria could cause symptoms such as severe abdominal pain, bloody diarrhea, seizures, strokes, and in severe cases of illness, people may die. So be sure to check your food and make sure it's not the contaminated bunch. Headed over to MSNBC.com, they're reporting on something called the July effect. What this is, if you made it halfway through July without being hospitalized and avoided the ICU on a weekend, consider yourself lucky. 2 new studies suggest that there are certain times when it's dangerous, even deadly, to seek hospital care, validating what doctors, nurses, and other healthcare workers have said privately for years. In one recent study, researchers found from the University of California at San Diego that fatal medication errors rose to 10% in July in U.S. counties with teaching hospitals, giving credence to what's long been known as the July effect. That's the notion that deaths go up in July, the month that just graduated medical residents start their new jobs, likely because of mistakes caused by inexperience. This recent research examined more than 62 million U.S. death certificates from 1979 to 2006 and found a spike only in July. The research also found that the jump was higher in counties with greater concentrations of teaching hospitals. So if you can hold off to August, it's better for your health. And to top off today's medical and health headlines, we head over to the U.S. Department of Health and Human Services. They're reporting that administration announces regulations requiring new health insurance plans to provide free preventive care. Departments of Health and Human Services, Labor, and Treasury issued new regulations today requiring new private health health plans to cover evidence-based preventive services and eliminate cost-sharing requirements for such services. The new rules will help Americans gain easier access to services such as blood pressure, diabetes, and cholesterol tests, many cancer screenings, routine vaccinations, prenatal care, and regular wellness visits for infants and children. Under the regulations issued today, new health plans beginning on or after September 23, 2010 must cover preventive services that have strong scientific evidence of their health benefits, and these plans may no longer charge a patient a copayment, coinsurance, or deductible for these services when they're delivered by a network provider. Alright, that'll do it for today. Thanks for tuning in. As always, check out www.mditv.com/blog for all of your medical news and health related topics.